For 2021 reports to the United Nations Human Rights Council and General Assembly, the independent expert on the promotion of a democratic and equitable international order examined securing a safe and sustainable future with respect to the COVID-19 pandemic and a more effective and inclusive multilateralism approach. The United Nations General Assembly stressed that the responsibility for managing worldwide economic and social issues, including pandemics and other health-related global challenges, as well as threats to international peace and security, must be shared among the nations of the world and should be exercised multilaterally. The United Nations further published a report on this issue from the world's only Hindu nation, Kailasa, and Supreme Pontiff of Hinduism, Jagat Guru Mahasanidhanam, His Divine Holiness Bhagavan Nityananda Paramashivam. The report addressed the following. What are the key obstacles to a more effective, inclusive, and networked multilateralism to handle the COVID-19 pandemic in terms of both health response and economic recovery? What are the solutions to overcome such obstacles in a fair and sustainable manner, including targeted reforms? Revised economic policies. Human life is more precious and important than all economic principles or systems in totality, because all of these concepts are legitimate only because of their utility value, which is to fundamentally make human life better. At least until this ongoing crisis ends, all economic policies related to money, banking, fixing prices of commodities, etc. need to be revised to make sure no human being suffers from hunger or the absence of required medical care. As per Hindu principles, the world, including the economy, evolves through 5 phases. First, the creation or growth. Second, sustenance or stagnation. Third, recession or revitalization. And fourth, reinvention. Fifth, breakthrough. As per Hinduism, conventional economic growth is observed best when practices are applied diligently. However, during times of crisis, lead us to the 4th and 5th phases, wherein the need to reinvent and deliver a breakthrough becomes both a survival need and an opportunity to surpass any means and measures of conventional economic growth. According to the Keynesians, increased public expenditure during the Great Depression of 1929 improved the economy. However, the government never completely gave up trying to balance the budget, which resulted in it never spending enough to bring the economy out of recession until the Second World War. Similarly, the current crisis requires governments to temporarily discard trying to balance economic interests that compromise quarantine safety and put human life at risk, and rather reinvent their economic strategies and multilateral coordination for benefiting during the subsequent breakthrough period after the end of the crisis. Hindu multilateralism. There is an immense equality in the capacities of governments, organizations, and people on 2 grounds: health response and economic recovery. Surviving the highly contagious COVID-19, where the world is only as resilient as the least resilient country and person, requires governments, organizations, and people to collectively address the crisis. From 3200 BCE, 56 nations in Asia had multilateral treaties based on the Hindu principle of Vasudhaiva Kutumbakam. Entire world is my family. Provide sustainable community livings with multi-layered quarantine. Home or self-quarantine is not a viable solution for a vast majority of people for either health, safety, or economic reasons. In Assam, home quarantine has been reported to be a primary reason for a large number of deaths. In some places, governments have moved people out of home quarantine to COVID care centers. Other issues linked with quarantine, especially in small houses, are mental health problems, such as an increase in suicidal ideation, especially amongst the younger population. This requires friendly quarantine setups, which are self-sustained and sufficient in terms of food stock and supplies, recreation, employment, education, etc. In India, state governments have attempted to provide free and paid solutions which face various challenges related to hygiene and exorbitant pricing. Some facilities have seen challenges related to requests for private accommodation. Experimental townships such as Oroville have demonstrated a fair amount of success in creating a friendly, safe, and compliant quarantine facility. However, solutions such as Oroville are not open to the public. For 2 decades, the leader of the Adi Shaiva minority tradition Hindu community, the Supreme Pontiff of Hinduism Jagat Guru Mahasanidhanam, His Divine Holiness Bhagavan Nityananda Paramashivam, had been creating townships like Oroville across more than 100 cities in several countries. Most of these townships, such as the ASMT Monastery India, Bengaluru, have been open to offer multi-layered quarantine as a free public service with free food, accommodation, and free internet to work from home in the monastery. The ASMT community has seen a fair amount of success in these townships with 0 reported cases of COVID infection in the past 2 years and has already saved many lives. The Supreme Pontiff of Hinduism Nityananda Paramashivam has urged citizens worldwide, especially from regions severely affected by the pandemic, to protect themselves as the topmost priority and avail these free quarantine facilities that the community has created, especially as home quarantine has failed. Educate citizens on individual pandemic management. Unlike previous pandemics, the current era provides active, real-time, and visual information about fatalities. Underreporting of this data may give false hope and make people reckless. Exaggerations in reporting can also make people reckless, as they may feel eventual death due to a coronavirus is inevitable. Proper education is extremely crucial, as it will dramatically reduce the number of deaths and reduce challenges to the healthcare systems. Alcohol-related deaths have hit a record high during this pandemic, and long post-lockdown liquor lines are some extremely worrisome issues regarding which people need to be educated. As a top priority, people need to be given confidence in their life and security about their future for them to stop behaving recklessly or fall into depression and commit suicide.